I'm with Mark Hathaway, who's flown down from England to work with us at Global Health Clinics. Mark's a specialist in a whole lot of well-being and health reform. But at the moment we're going to be discussing the dry blood analysis that can be done from anywhere in New Zealand. We would post a kit out to people. They put their samples in the kit, send it back to us, and Mark or Julie Kershaw, our two specialists, will be analysing the blood. Mark, would you briefly discuss for our audience what would happen once you've had a look at this blood? What sort of things would you like to be seeing? There's some dry blood there, for example.
Yeah, well, this is an example with dry blood. Yeah, we can actually see the dry blood. We can see some actually markers of parasites. So one of the things with dry bloods is we're looking at the environment. We're looking deep down at the environment to see. It's almost like looking into the future as well with dry blood. So we're looking for different markers to be able to tell us where the stress is in the body and how serious the stress is in the body. So with dry bloods, it's very accurate in regards to pinpointing where the problems are and how serious the problems, and gives us some priorities as far as what we need to do in regards to addressing those issues. So it can be anything from parasites, oxidative stress, poor digestion, poor mineral assimilation, lymphatic congestion, heavy metals, all the adrenals,
hormones.
Yeah, we can have hormones, thyroid issues, cardiovascular issues. We can also see markers of precancerous conditions. So because we're looking at the environment, of course everything's at the mercy of the environment. So it's the environment that's going to tell us what we need to do and what we need to correct. So yeah, it's very powerful.
So these are the thing about blood that most people don't understand. There's about between 25 and 35,000 million blood cells.
Yeah.
It's travelling over 100,000 kilometres of blood vessels. Most of those blood vessels are thinner than a hair, and those thin blood vessels called capillaries, only one blood cell can fit through at a time, can't they?
Yeah, exactly.
So if the blood's clumping, it won't go through the capillaries to feed the cells effectively.
Yeah.
Then the blood's carrying nutrients out to every cell and carrying the waste back, isn't it?
Yeah, exactly.
So blood is such an important part of our health, and we expect our heart to push blood for over 80 years, feeding every single cell in our body, removing all the waste, and yet most people don't look after their blood properly, do they?
Yeah, exactly. It's a very important part of our flow systems in our body.
Yeah.
Because without flow, without movement and flow in our body, how are we going to get nutrition into the cells? How are we going to get toxins out of the cells?
Yeah.
How are we going to get oxygen into the cells, which are going to help us produce energy, which is obviously going to give our body the ability to be able to do the healing, let alone walk around the block.
And then we still got to get the waste back out, back down to the liver, and eliminate from our body.
Absolutely, and I guess that's another aspect of dry blood is we get to see the lymphatic system, and it's very common to see lymphatic congestion, which means we're not detoxing very well. Yeah. It's very common to see liver stress, which is another means of detoxing. So when we see these conditions, it really gives us some priorities as far as what we need to do, because if we're not detoxing, it's almost pointless doing anything else. We've got to make sure that our flow systems are open. Right. We've actually got some flow.
Yep. So we only need 2 drops of blood, or 1?
Well, we can do one drop of blood.
From a pinprick, like a diabetic pinprick?
Yep, a pinprick, really you're not even going to feel it.
Right. By the time the blood comes back to us, within a day we'll have the results.
Yep.
And then you'll be able to put a program in place based on the blood. Now what we'd like to do here is use our epigenes or our cellular well-being tests in conjunction with this.
Yep.
So for most people we recommend they do both. Some people say, no, I just want to do my blood.
Yeah.
But if we do the cellular well-being or the epigenes analysis, it tends to correlate what we see in the blood, doesn't it?
Yeah, absolutely. I think the blood's a good opportunity because it's very visual. Yes. People like to see it.
They like to see the blood.
We like to see. Seeing is believing, and you can't not see what you see in the blood, and the blood won't show anything that isn't. We don't necessarily always see everything in the blood, but what you see is going to be there.
Real effect.
So. Yep. I think it's a really good start for a lot of people just to have a look at their blood, and that takes them to the next step. We're seeing some issues, we're seeing some problems.
Yep.
What are we going to do about them? We need to dig deeper.
Yep.
And more often than not, we need to dig deeper.
So if they're doing a blood test with a report, they'll get some copies of their blood sent back to them, some images, with some comments about what they represent. So can you tell me what this blue stuff here is, Mark?
Okay. Well, we've got here, we can see we've got the white specks, for instance. We've got the white specks, that's gut sensitivity. Okay,
is that lymphatic congestion as well?
Well, okay, if we've got, Oh, it's not showing on this one lymphatic congestion as such, but maybe a little bit of lymphatic congestion here.
Down there,
but
these
we've got
lakes.
anything white is where we've got a little bit of degeneration, okay?
Yep.
Anything dark is where we've got higher levels of fibrin, a clotting protein, and you can see they're dotted over the place. So we know there's a very high chance that that's parasites.
Yep.
And of course, if we have parasites, we're going to have high ammonia. If we're going to have high ammonia, we're going to have all sorts of problems. So
Yep.
just picking up parasites
So
alone.
these parasites are peeing into our blood.
Absolutely.
Right.
Yeah.
So the reality for this is they need decent antioxidants, they need amino acids, they need essential fatty acids, vitamins and minerals.
Yeah.
They need to chew them well, and they need to digest them well to build this blood, don't they?
Yeah.
If they're low in any of those fundamental nutrients, or they're not digesting them well, that will reflect immediately through the blood.
Exactly. Yeah.
So we do a lot of therapeutic work here, Mark, and using our conventional methods, sort of 2 to 6 weeks to see really good results and improvements from
Yeah.
the blood. You've seen some of the before and afters with our quantum healing. We can actually do work to improve that blood in less than 2 hours, can't we?
Yeah,
There's multiple ways, whether it's quantum healing, nutrition, detoxing, the oxygen and ozone systems,
yeah.
various sorts of frequency medicine, even mind-body medicine will make a difference to how the blood performs. Whichever way you do it, we want to see radical improvements in your blood within 2 to 6 weeks, aren't we?
And we will, and we do.
Yeah.
Absolutely. So it's once again, the blood gives us a bit of an overview, looking at the environment, and an indication as to what we need to do with all these other therapies. And we want feedback as quick as possible. So I look at blood analysis as like accelerated healing, if you like,
Yeah.
because it speeds up the process, because we need to be able to gauge
Yeah.
how the body's responding.
Yeah.
And that's going to then direct us as in regards to what we need to do in far as tweaking some of the things we're doing.
So going back to the heart and blood, our heart beats on average 100,000 times a day. Now that blood is being pushed out and back 100,000 times a day.
Mm-hmm.
The maths behind this is so spellbinding. It's amazing how body functions as well as it does, considering how little people actually know about how their body functions. And the blood is probably the marker that most people rely on the most for their analysis.
Yeah.
But almost nobody knows about these live and dry blood tests. Now, talk to me about a live blood test, Mark, where you actually see the blood cells.
Well, live blood's also very fast. With the dry blood, let's just go quickly back to the dry blood. When we're looking at dry blood, we're looking at it like a composite of 3 months.
Yep.
Because blood lives for about 3 months. You're not going to see it in dry blood unless it's something that's quite consistent. Live blood is right now. Let's have a look at what's going on now. We have a look at the immune system. We can have a look at the toxins. We can have a look at the flow. We can have a look at what we call zeta potential, blood cell, to make sure the blood cells are dispersed and flowing.
And electrical charge.
Electrical charge. To make sure we do have that flow, because if we don't have that flow, once again, we get agglutination. We get the system
Stagnation.
clogging up. That's right.
So you'll also see white blood cells in the live
Yeah,
blood?
we'll see white blood cells.
Parasites and viruses.
Oh, sometimes we'll see parasites. Sometimes we'll see bacteria.
You'll even see sometimes the white blood cells chasing after something
Yeah,
like a parasite or a
absolutely.
bacteria and gobbling it up, won't you?
And that's another important part about live blood, is that we get to see how active your immune system is.
And a lot of those white blood cells.
Absolutely. We get to see how active they are, because some people's immune system isn't very active.
Yeah.
We may have all these other markers that say, yeah, immune system's good,
Yeah.
but if we look on the system and we look on the live, we're actually looking at your live blood.
Yeah.
And depending how long the white blood cells take to get active can give us an indication of how sluggish your immune system is.
Yes.
And that's obviously very important too, for sure.
Yes. So, summarising this, there's the live or the dry, or the combination of both. If you're available in the clinic, you can do live and dry together. If you're outside the clinic and you want to post samples into us, it's just the dry blood.
Yeah.
It works extremely well in parallel with the epigenes report, which is using hair and hair follicles. The epigenes report will give us a very comprehensive written report.
Yeah.
The dry or live blood will give a pictorial report. And if they're just doing the dry or live blood, you can still write a report from, give them a lot of recommendations, can't you?
Yeah, absolutely. Look, the more we can look at, the better, of course. We can tick the boxes,
Yeah.
and get very, very accurate in regards to what's going on.
And what we like to do is put a plan in place and then check
Absolutely.
and maintain.
And use the blood and some of the other modalities, the other tests that we do to be able to gauge the response
Yeah.
that the body's, because we've got to be able to gauge that, and and to be able to interpret how the body's responding to what we're doing.
Now, how many people's blood have you tested, do you think, over the years?
Over 10,000.
10,000. So you'd be one of the most experienced in the world at this.
I've done it, yeah, especially with dry blood. I've done more dry blood than anything else.
And you've
for
come
sure.
down from England especially to work at global health clinics to try and
Yep.
help people and put some foundations
Yeah,
in
absolutely.
place. Yeah, great.
Yes.
Thanks very much.
Okay.